My name is Natasha Knowlton, and I'm a nursing student at Miles Community College. In this video, I will be starting an IV. So when you are starting, you'll want to check your provider order and see what type of solution they've ordered, also the infusion rate and how long. In the MAR, you'll want to check the patient's identity, and you'll want to check for any allergies, especially latex, or if there's anything to the tape. You'll also be doing your 6 patient rights, so you want to make sure you have the right patient, the right medication, right dose, right time, right route, and right documentation. You'll also, when I go to identify your patient, you will have your patient, and can you tell me your name?
Mariana White.
Can you tell me your date of birth?
September 21st.
What year?
14th.
Okay, so we've done our 2-patient identifier. We'll want to check our equipment and get our supplies ready. So when you're doing that, you want to check the expiration date of all your equipment. Make sure it's not expired. Make sure it hasn't been tampered with or opened, and it's the right solution you're getting. So we have our 20 gauge catheter, our saline flush, our NF, a tourniquet, a saline lock, alcohol prep, gauze, tape, transparent IV dressing. We also have our tubing. You want to make sure you have the right tubing, and that is a primary tubing. And first you'll want to do proper hygiene when you meet with your patient. So you'll wash your hands, and you will explain to your patient the procedure you are doing, why you are doing it, ask them if they have any questions. This will be done on the patient's bed, so you'll want to adjust the bed to a level that's comfortable for you. You'll also want to make sure you have your gloves on and all of your supplies. Of course, your gloves go on after your hands are washed. So in this video, I am not actually doing an IV on my daughter. I will just be taping the catheter to her arm. So if the patient doesn't have any questions, you'll want to pick the arm. You'll want to assess the site. If they have a very hairy arm, you can trim that so it's not getting caught in the tape. You'll take your tourniquet. You're going to apply that. Sorry. You want to apply that to the patient's arm. You also want to make sure you have your blue pad to protect your patient from any blood or solution that might leak out. You'll want to identify a vein, check the radial pulse, and if everything is good. So according to the steps, we'd have to take the tourniquet off. All of our supplies is ready. And
you might want to put that on for the needle.
So we'll reapply the tourniquet without causing discomfort to the patient.
What's that?
It's alcohol. You're going to take an alcohol prep pad. And so in this patient, we're pretending to do the radial vein here. You apply your alcohol. You let that dry. And make sure you check your supplies and that it's the right size for the patient. So in this one, we are using a 20 gauge catheter, and this is not actually being put in my daughter. So what we do is you want to...
Oh yeah, that's fake needle.
You want to make sure the bevel is up on the needle, and when you are applying the IV, you're going to have your vein identified. You'll use your non-dominant hand to pull the vein back. You will then take your IV needle, and you are going to put that against the patient's vein at about a 30-degree angle, and you are going to advance the needle in, and you'll know you have a vein if you have flashback in the catheter, which will appear in here. You'll have some blood. So once you have the flash, you'll advance your catheter in, and you're gonna pull back on the needle and make sure that's locked, and that will go in the sharps container when it's disposed. So the catheter will be sitting like this on the patient, and I'm just going to tape that on here so we can pretend we have something real.
Alcohol hurts, but at least it dried.
So we have the IV catheter that's in place. So on these, you'll need to apply pressure so you don't have, because you will have blood coming back if you have a good vein.
That a good vein?
Yep. We're going to take our saline lock. We also have our saline.
Hi, Claudia.
With that, you want to make sure you have all the air out. And that's applied
Phone's calling your
to
computer.
the saline lock. You're going to apply that lock to the IV catheter. You can pull back a little bit and make sure if you have blood return, you have a good site. So we are going to push approximately 5 milliliters of saline into...
Mom, it doesn't even hurt.
Because we're pretending.
Yeah.
We're going to flush the IV site with saline. You'll want to make sure and check the site. Make sure it's not bubbling and that it's a good site. Ask the patient if they have any discomfort. So if that site is good, you need to go, son. So we're going to take our gauze, and that will be applied under the catheter. And we are going to do a chevron with the tape.
I can't help you, Ansel, because Mom's doing the video. I can do this.
Oh, son. So with that, you can take a small piece, and that would sit under the catheter, and it's going to cross over to what they call the chevron, and that holds it in place. You'll also take your tegaderm, and on your tegaderm you want to put your initials, the date and time that you did the IV.
I wondered what an IV looks like, and my mom's daughter. And my mom, she's in.
And also the tourniquet has been removed before we flush, so go, son.
Something.
So this goes on there, date, time, your initials, and we're going to check. So we're using a primary line, and it's a 10 drop per milliliter. So again, check your supplies. Make sure it's not.
It's only fake. It's only
sure it's not expired and not tampered with. Here's your saving. Here will be.
Emily's not gonna be in there.
So on this, when you're spiking the bag, you want to keep everything as sterile as possible. You need to go now. That top comes off. This part goes in there. And so you don't make a mess, you'll want to make sure you have have that locked before you started. And you're going to do this, and you want to prime it and get some fluid in there. So what we're going to do, part of priming is making sure you have all of your air bubbles out.
Yeah, like she has the air bubbles. What are the air bubbles? Well, what are air bubbles?
This is the pretend IV pull I have. Can you hold that? So you're going to prime. Make sure you get all your air bubbles out on the end there. And then you're going to close that. We would take our N, apply it to the patient's IV. Of course, that you would want to wipe that with alcohol before applying your tubing. You want to make sure you have the right infusion rate going and that the no issues and that everything's flowing the way it should be. Make sure you have the accurate rate and the accurate infusion time. You want to observe the rate, observe your IV site to make sure it's not having any issues. You also want to check to make sure how your patient's doing, and if everything is going well. You'll also want to label on your IV bag here. You would have your patient's name, date, and time, your initials of the solution, and you'd also do that on tape. Put tape on the tubing on the date, time, and initials of when that was started. And once you've completed your stuff, you want to make sure your patient is safe. Lower the bed to a safe level. And if everything is good with your patient, you'll want to teach them about their infusion and how to use it if they are needing to maintain their infusion, and to notify you if they have any questions. So with them being in the hospital, you'd give them a call light, make sure they have everything they need, the bed's in a safe position, and you would clean up your supplies, put your sharps in the sharps container, and you would wash your hands, and you would document what you have done in your patient's chart.